Hello, welcome everyone. We are very exciting for our upcoming 16th annual Canadian Holistic Nutrition Conference. This year we are discussing nourishing our future, exploring the science and power of nutrition. We have two conference dates, one in Calgary, April 13th, and one in Toronto, May 11th, excuse me. And I am very excited because today I get a few moments to speak with our keynote speaker for the Calgary conference, Dr. Nigel Plummer, sponsored by Atrium Innovations, who is coming to speak on the integrative effects of probiotics on whole body health. Welcome. Thank you so much for joining us today.
Thank you. Thank you. It's glad to be here.
Yeah. Can you tell us a little bit about why you're so passionate about this topic?
Well, I've been working on in the area of the microbiome and on probiotics for over 35 years. And that sounds like an awful lot. It's almost a lifetime I've been working on this.
Yeah.
And during that time, we've done a number of things. We've developed our own probiotic strains. We're a developer of probiotic strains within the UK. We also are a manufacturer of probiotic products. But one thing that kind of stands out with us compared to other companies and compared to other research groups, we've done now over 40 full double-blind published clinical trials.
Wow.
Over that 35 years. And in that time, what we've seen is just how effective probiotics can be as proxies for our microbiome. And also during that time, what we've seen in that, and these are double-blind trials. And one of the things that's really good about double-blind trials is that they are double-blind. We don't know what's going to happen. The patient doesn't know what is going to happen. The administrators of the trial don't know what is going to happen. So it's a kind of big gamble, if you like, a big risk. But what has happened from that, of those 40 clinical trials that we've done, 39 have shown positive benefits. And one has shown like there wasn't any real benefit. But 39 of those trials have shown, and again, I repeat, they're double-blind placebo-controlled trials. 39 have shown positive benefits. One showed that there wasn't any significant benefit, and we haven't had any adverse outcomes from those trials.
Yeah.
And
Wow.
what's been interesting and so I suppose a development and an evolution during that time is that when we first started off 35 years ago, this is before the term microbiome and microbiota had ever been. It was even before the term of probiotic, just about.
Yeah.
So it was right at the early stages of really working on this. And we were looking at things like reduction of diarrhea, so prevention of antibiotic-associated diarrhea, because that's where we thought probiotics that was where their function was. But over the last 35 years, we've now increasingly seen that because the microbiome and our knowledge of the microbiome has become so great now, so much greater than it was 35 years ago. And what we're realizing is that the microbiome can have an impact on almost every part of our physiology. And as proxies for our microbiome, probiotics can do exactly the same thing. So as we've gone through that 35 years, we've not only seen these intestinal effects, but we've seen effects on immunity in babies, immunity in children, immunity in adults. We've seen effects on gut-brain axis, so depression, anxiety. We've even seen, and our latest trial is on Alzheimer's disease, and we've seen impacts on that. And we've seen things like an impact on weight management, for instance. And we've seen an impact on lowering cholesterol. And we've seen an impact on something that's a little bit sort of off the wall, but improvement in athletic performance. All of these from probiotics, and very often, and this is the real kind of clincher really, we're seeing these benefits at the same time, so simultaneously. So increasingly now, when we're doing a clinical trial, we're seeing benefits of seeing outcomes where we're seeing improvements in intestinal health, in immune health, in mental health, all at the same time. And when we're measuring them as outcomes, it's just, and you say to me right at the start, why am I so passionate about this? It's because of that. It's because what we're seeing now is that probiotics can be so incredibly effective. And as well as seeing that in terms of the proof from double-blind placebo-controlled trials, we're seeing it from the results we see in literally thousands of patients. And so, yeah, so why wouldn't you feel passionate about it?
Yeah, that's amazing. That's amazing. Now, what are we going to, can we expect from your presentation this year?
Well, it's basically going to be a synopsis of really what I've just said. So it'll be a description of our microbiota and our microbiome and how it relates with our physiology. And that people might say, well, I know a bit of that, but there's certain things that I know that they won't know, and certain things that will be really critical to their to the information and to their knowledge of what the microbiome is and how it interacts with us. And then I'm going to take them through a journey that I've just described, really, of how we've learned more and more about the microbiome and more about how probiotics act as simple proxies for our microbiome and how effective they can be. And they will get an appreciation at the end of that of, well, I can actually use probiotics here, and I can use probiotics here, and I can use probiotics here, because probiotics are really acting as I say, proxies for our microbiome. And we know that the microbiome has potential benefits in this area of our physiology or in this area of our physiology. And so we will see, as a result of that, an impact on our whole body health, more than you can really see from any other what you would call single type of dietary supplement. It's amazing. It's amazing.
Yeah. Now you're going to be speaking nationally to a big group of holistic nutrition practitioners that are just so excited about the gut microbiome. And, we see here in Canada, lots of our clients are struggling with all sorts of gut issues, right? Gas and bloating and diverticulitis. Will there be some strategies that we can take away within our scope of practice that we can begin to use with our clients from your presentation?
Oh yeah, absolutely. And what we're seeing now is that probiotics can have an impact on their own, but you can also combine probiotics with other interventions to have an even greater impact. So, for instance, immunity. You can have probiotics. We know that on their own can have an impact and a significant impact on our immune function, and probably have the most quantitatively great impact on our immune function. But other things can also have an impact too, like vitamin C, vitamin D, elderberry, etc., zinc, and so on and so forth. And these are additive because they work in a different way. So we'll see, if you like, strategies of intervention that involve probiotics, but also other types of multi-nutrient to give what I think is an optimized approach to any type of pathology that the person might be looking at.
Amazing, amazing. One more question before we let you go. We love to ask all of our presenters, do you have a hidden talent or maybe one fun fact about you that people might not know?
I don't have any hidden talents or nothing that I can mention on the video anyway. So,
Yeah.
but no, seriously, no, no real hidden facts other or thing. I do have I am, as well as being passionate about our microbiota, I am passionate about classic cars,
Oh,
and mainly American cars. So there you go. So
very
I've got
cool.
a collection of American cars, even though they don't really work on our very narrow British roads. So
Right.
so they're a bit challenging, but they're great at the same time.
Perfect. Perfect. Well, thank you so much for taking some time to speak with us today. Remember, please grab your early bird tickets. You are not going to want to miss this presentation and more at our upcoming conference. Thank you so much for your time.
Okay.
Goodbye.